Hi, my name is Lisa Wiggins. I'm a behavioral scientist at the Centers for Disease Control and Prevention, also known as CDC. I'm lead author on the paper Toileting Resistance Among Children with and Without Autism Spectrum Disorder. For this paper, we use data from CDC's ongoing Study to Explore Early Development, also known as SEED. SEED is currently the largest study in the United States to help identify factors that may put children at risk for autism and other developmental disabilities. Autism is a condition recognized in early childhood that can cause significant social, communication, and behavioral challenges. With data for more than 6,000 children and families, SEED presents an unprecedented opportunity to learn more about children with autism. The goals of SEED are to better understand the risk and protective factors for autism, identify observable characteristics associated with autism, and assess the health and needs of children with autism and other developmental disabilities. Mastery of toileting skills in the first few years of life is an important developmental milestone. It empowers children and prevents future problems with bladder and bowel health. Most children begin toilet training between 1.5 and 2.5 years of age and achieve daytime continence by 3 years of age. Some studies suggest that children with autism achieve continence later than other children. Using information gathered from questionnaires completed by mothers, this paper reports on resistance to toileting training among more than 2,000 children between 4 and 5 years of age in 3 groups: children with autism, children with other developmental delays, and children in the general population. We also looked at the relationship between toileting resistance and certain behavioral, developmental, and medical factors. Consistent with previous studies on this topic, we found that children with autism were significantly more likely to resist toileting than children in other study groups. Specifically, among children with autism in this study, almost half, or 49%, were reported to resist toilet training. Among other children with developmental delays, 24% were reported to resist toilet training, and among children in the general population, 8% were reported to resist toilet training. Additionally, diarrhea and problems with the ability to pick up on social cues were related to toileting resistance in both children with autism and children with other developmental delays. Constipation, language delays, and problems with social motivation were related to toileting resistance only among children with autism, and problems recognizing shapes and patterns along with oppositional behaviors were related to toileting resistance only among children with other developmental delays. These results provide important information for parents and providers on the occurrence of resistance to toilet training among children with autism and other developmental delays. Importantly, these results may facilitate discussions between parents and providers about effective treatments for conditions that may place children at increased risk for toileting resistance. Moving forward, CDC will continue to conduct research with individuals with autism in early childhood and throughout the lifespan. This research will help us better understand how we can help people with autism and their families live their lives to the fullest. For more information about CDC's activities related to autism spectrum disorder, please visit cdc.gov/autism.